Hi, my name's Sheila. I'm a therapist here at the St. John Clark Pain Treatment Center, and I practice neurosomatic therapy. One of the things we do as neurosomatic therapists is something called visceral massage, which actually means massaging the organs themselves. So I have a patient that I recently treated for incontinence, and we worked on her bladder, and she had instant success with her incontinence from that treatment. And she came back to me saying, everyone has to know this. My father needs to come here. You know, I know people that have this issue and it's embarrassing and it's hard to treat. So this was so successful with me. I really want you to tell as many people as you can about this. And so that's what inspired me to make this video. So let's talk about the placement and structure and basic anatomy of the bladder. The bladder sits inside the pelvis, right behind the pubic bone actually. And when it fills, it can hold about a pint of fluid. It can fill up and kind of distend your abdomen slightly forward. So the bladder itself has several layers. And we'll look at this picture first. The thickest layer of the bladder is the muscular layer. So the bladder is actually comprised of muscle. When your bladder fills, your muscle walls actually expand and stretch. And when you void, the muscle walls contract. On the other page here, we have some muscles that you'll see on the outside and the bottom of the bladder. These muscles act as a sphincter. And so when you're releasing your urine and you're voiding, the sphincter relaxes. And the opposite's true when you're holding a full bladder. The sphincter needs to stay shut. So there's a very complex mechanism of signaling between your nervous system and the bladder. And this really has to do with how we treat the bladder. So when the bladder is full, it stretches the muscular walls of the bladder itself, and it signals the need to empty the bladder. So what can happen is if you have a tight spot on the bladder, it can actually tug around on other areas surrounding the tight spot and trigger that tightness to the nervous system, which might make you have to void out. And that could be one of the many different types of incontinence. So what we can do with our visceral massage as neurosomatic therapists is actually massage the tight part of the bladder itself, just like you would massage a tight muscle anywhere else in the body. And by doing that, it makes a more uniform kind of amount of tightness in the bladder itself, so there's not a mixed signal going to the nervous system. So where does this tightness come from? So there are several ways you can get bladder tightness. One would be trauma. Another would be pregnancy. Also for males, an enlarged prostate. So several different reasons why you can have the bladder encroach upon and bring about some tightness. One that often is overlooked is actually a mechanical structural imbalance. So as you saw in the beginning, the bladder sits right inside the pelvis. So if you have a distortion like a flexion disorder, you can see how that would place a lot of torque on this soft structure right in the middle there. Other distortions like an obliquity would do a similar type thing. And another distortion, the pelvis sits somewhat at an angle forward, but if it's a little bit curled under or extended, this actually can weaken the pelvic floor. So there are several approaches to working with the bladder. We have to find the root of the problem, perhaps add some pelvic floor strengthening, perhaps not, it's not for everyone, as well as releasing the tissues of the bladder, which can be very effective in helping your incontinence. So if this is in fact a muscular issue, I wanted to show you a quick little palpation technique to see if this is something that could help you. So this is actually an example of how we treat the bladder at the clinic too. So right above the pubic bone, you'll feel the hard bone there. Right above that, you can kind of palpate around as if you're kind of searching for a small water balloon type feeling. So if you're slightly full of urine, not too full, you'll be able to feel it better. And if you find a tight spot, a spot that might give you a sensation, then that might be actually the reason for your incontinence. So if this is something you feel like could help you, give us a call at the clinic. It's actually a very simple outside external process to get the bladder to release for a problem that could be very difficult to treat through other means.